Welcome everyone to the September 4th, 2024 CHW Learning Circle. Thank you for joining the Minnesota Community Health Worker Benchua Learning Circle. The Learning Circle is a free monthly peer learning session held remotely on the first Wednesday of each month from 3 to 4:30 p.m. This event offers community health workers a platform to connect, learn, and share knowledge. It's facilitated by Benchua's Associate Executive Director, Angela Fields. This lesson covers essential topics such as the CHW role, professional skills, workforce development, and current health trends. This allows us to embrace the opportunity to learn about experts and peers, enhancing how they are enhancing the impact of CHWs across the Minnesota, and supporting our guiding principle, nothing about us without us. Today, our September 4th presenter is Karina Smith, Director of Birth Justice Collaborative. Karina will provide an in-depth overview of the Birth Justice Collaborative, commonly known as BJC. It's an initiative dedicated to advancing birth justice in maternal and infant health. This session will explore the mission, the vision, and the key strategies of BJC as they work and talk about their work to address systematic disparities affecting birthing people, primarily within African American and American Indian communities. Whether you are a CHW, an advocate, a CHW leader, or simply passionate about maternal health, this session will provide valuable information on how you can support and engage in the Birth Justice Collaborative. And here's a little bit more about Karina Smith. She has a background in nursing and is passionate for reproductive justice. Karina skillfully operates at the intersection of policy, political, and health equity. Her professional experience is deeply rooted in collaboration, and she embraces the spirit of grassroots power building. Karina's mission extends to helping organizations navigate the multifaceted challenges of our time, from the practical work of organizing and facilitating meaningful conveying to broad coalition building for collective well-being. She's dedicated to combining her knowledge in social, clinical, and political determinants of health to build and co-create a healthier community where everyone can thrive. So thank you all for joining us for this presentation, and I'll turn it over to our presenter, Karina Smith.
Thank you so much.
You're welcome.
Welcome, everyone. I'm going to dive right in, and then we'll also have some time for questions towards the end as well. Okay, so I'm with the Birth Justice Collaborative, as Angela already shared, and we are an initiative that's really that launched in 2022, and we're really focused on African American, American Indian disparities, particularly how do we collectively advance maternal health and birth justice across both of those communities, and we do that through a coalition. So we both raise up priority strategies by meaningfully engaging our communities throughout the coalition. We then also incubate and do collaborative strategy implementation that we then move into movement building work and storytelling across sectors and culture to both resource, realize, and replicate our work. And we do that with our guiding partners, of which we have six American Indian, 6 African American. Those are the Division of Indian Work, Liberty Northside Healing Space, the Cultural Wellness Center, the Native American Community Clinic, Minnesota Indian Women's Resource Center, and Robert J. Jones UROC Urban Research and Outreach Engagement Center. So again, as I already shared, we're collectively advancing maternal health and well-being across both of our communities, and a lot of us, because of the work that you all do, you know the disparities, that in Minnesota, 60% of our pregnancy-associated deaths occur between 6 weeks after pregnancy up to 1 year postpartum, and we're deemed 100% preventable, and that's from the MDH Maternal Mortality Review report that came out. And so knowing that data, which we already knew, coupled with the experiences that our communities are actually having. So we knew that to already be true, but that's really part of what we're doing, is to try to address those disparities. African Americans are 3 times more likely to die from pregnancy-related causes compared to white Minnesotans and white people, and our African American, American Indians, sorry. Comrades and relatives are 8 times more likely to die from pregnancy-related causes when compared to white people. And so part of the outcomes that we seek overall, though we do have particular outcomes and evaluation components related to all of the initiatives that we do, BJC as a whole is looking at increased inclusion of cultural providers and community members in perinatal support, increased culture provider payments and supports that reflect the true costs of addressing the historical and ongoing impacts of racism, increased family access to trusted cultural providers and resources, and increased anti-bias accountability in providers and systems that improves birth experiences as reported by families. And so again, long-term evaluations are underway to demonstrate the long-term improved birth experiences and outcomes for our initiatives. So we have quite a few strategies and priority initiatives. And again, part of our work that launched in 2022 was from an initial community convenings of over 300 community members that then led to a 50-member cross-sector leadership coalition, which is now kind of the body of folks that we activate. So we have our 5 strategy groups, and within those, we have our initiatives that support and come out of those strategies. So we have a strategy to acknowledge and address the impacts of racism, of which we have an initiative for our postpartum support pilot, which is cultural home visiting and resources. What's unique about this initiative is that it is a home visiting model, but it's also coupled with financial resources, wraparound support, food resources, et cetera, which typically aren't necessarily demonstrated together. And so we're really excited about doing that. And part of what we heard from community is that that postpartum period of that first year is where families feel most vulnerable and really need some extra support. And these were some of the resources that community said would be supportive. This pilot is a cohort-based model. So it launched earlier this spring. Division of Indian Work and Cultural Wellness Center are the 2 lead partners leading that work, with 2 cohorts of 20 families participating in each one. And I can go deeper into these as well. For the strategy to support a coordinated system of anti-bias and accountability, we have some initiatives that folks participated in. We had some community education forums this spring that also resulted in a advocacy guide. What we heard from communities, both they want to have the resources and education to advocate for themselves, and they actually just want some tools to be able to do that. That was also part of our collaboration and promotion of the Earth app that has also recently launched here in Minneapolis. An obstetric racism pilot with Twin Cities-based healthcare system, which is underway in terms of locking that in. And that's also referring to Dr. Karen Scott's work around PremOB, if folks have heard of that model. She also has a few other ways that she supports healthcare systems in disrupting obstetric racism at the point of care. And then we have enhancing and expanding the anti-bias curriculum. So this was both an effort to expand and do some feedback in a 2.0 version of the modules that were available coming out of the Dignity in Pregnancy Act, but there's also an Indigenous Health Toolkit that we're looking at expanding and making more accessible for folks digitally, among other resources that we're looking at promoting and enhancing. For a strategy to support culturally meaningful workforce pathways, we did launch and get some insight into designing 2 cultural provider councils, an African American, American Indian one, that can really be accessed by healthcare systems and folks who generally need feedback and input from community, but don't necessarily have the relationships, and that both help inform our initiatives as a whole. And then cultural provider supports for businesses. That I'll also touch on. All of these strategies and initiatives are not necessarily exclusive in and of themselves. They very much intersect with each other. So in the invest in a network of trusted culture providers and resources, we have the African American Home Place, which is an initiative that is underway and looking to launch early spring of 2025. That is focused with our partner Northside Healing Space to create like a retreat center where families can drop in and receive care when they generally don't have that support system. And same thing for doulas and other folks that are giving supports perinatal through postpartum, so that they have a place where they can have business supports and resources, or a place where they can see their clients and families and do classes. We're also looking at an American Indian birthing center that is centered around the American Indian community, because we know that when people have more options and choices, they then can also have more outcomes that are more aligned with what they're looking for. So that's looking at birth as ceremony and as sacred, and being able to have cultural congruent care. But we also know that birth centers have better outcomes as well when people have the option to receive care from midwives, and also just out of hospital births generally. And then doula awareness, access, and support also ties into the business supports I mentioned earlier. We've partnered with the Birth Equity Community Council and African American Babies Coalition to provide doula pathway support around the implementation of a lot of the recent legislative wins around reimbursement and billing, but really to make sure that folks get the training and the information around how to actually bill. What are the steps needed, the NPIs needed, et cetera, to make sure that they're actually able to do that, which touches just about everyone who's doing direct service client work, and trying to make sure that they're able to bill when reimbursement rates are getting increased. And then we also have participated in the second annual doula appreciation event, which is again to provide awareness around doulas. What we still hear from community members is they don't know what a doula is or how to access one. And so doing an event that is both appreciation, but also connecting families directly to doulas. And then our last strategy is to advocate for a shared policy and payment reform agenda that we did implement and are still working towards this year. Again, part of that was to make sure that folks were informed through the education forums on the new laws and tools, both community and providers, that would impact families. And then we also implemented our legislative agenda, which was looking at pre-planning dollars for both the American Indian Birthing Center and home place planning. And then we've now moved into our administrative agenda around payment and reimbursement reform, looking at unbundling payments and making sure that we are advocating with our state departments and agencies around what that can look like. So that was a lot, and we've already had some progress and impact as we've been going. And again, all of the initiatives have evaluation components related to them. And so this is just some of what we know so far from the summer. So related to the culture provider and community member inclusion and the perinatal support, we have been able to host training for more than 20 BIPOC doulas in the evidence-based family spirit cultural home visiting model, which some folks might be familiar with. That is the model that we use for our postpartum pilot. And so we were able to invite and extend the invitation for other folks to come and receive that training. We also increased the number of family spirit home visitors in Minnesota by 16.4% just by allowing it to be extended to folks. We've also increased the family spirit sites in Minnesota by 11.7% by supporting a community organization to become an affiliate. And then again, we've launched the 2 cultural community councils to advance the expansion and role of cultural healers and providers. On our culture provider payments and supports, we have developed technical billing assistance curriculum, again, as I just spoke to, for cultural doulas and trainings. Those are launching this month, actually, some of those trainings. And of course, there is some overlap with cultural home visitors and other folks. So feel free to participate in some of those as it's helpful. Advocating for increased midwifery rates and billing capabilities. Held educational forums for cultural birth workers regarding the new tools and the payment processes, and implemented cultural doula appreciation event for over 100 doulas. Related to our trusted cultural providers, we did receive those 2 legislative appropriations that we're in the midst of implementing now to plan both an an American Indian Birthing Center and an African American home place. We've increased the number of American Indian and African American parents accessing cultural home visiting in Minnesota by 5.6%, and that's just through our pilot. We're sponsoring doula meet and greets for families, and on the anti-bias accountability, we have launched, we're launching that pilot with a major healthcare a major Twin Cities healthcare system to identify and address racism at the point of care, which is underway and coming to completion, nearing this end in terms of locking in the contract, and then that'll be starting end of this year and in 2025. And then advancing community-informed improvements to the anti-bias curriculum that we've been working with. And then again, engaging more than 200 community members around the resources and policies that impact pregnancy and self-advocacy. So a little bit about how BJC is organized and structured. We have our 6 partners that I mentioned at the beginning, and really their role is to oversee, direct, and allocate resources based on the strategy group recommendations. They are then our lead agencies and strategy groups, which the main role is to convene those groups to include community members, agencies, and system representatives to design and make implementation recommendations to the steering group. So each of our partners are lead agencies on components of the initiatives. And you can see those underneath in terms of which strategy group or parts of the work that they've led. And then BJC is supported by a coordination team, which is through the Collective Action Lab. And we do a lot of the administration, project management, communication, grant management, and evaluation. And we are fiscally sponsored by the Minneapolis Foundation. And this is just helpful for folks to understand, like, how did this new initiative come together and who's doing it, who's at the helm of it and such. And part of how we're structured within this coalition is to really understand that, one, and one of the pieces that's not here is our partnership with Hennepin County, which is one, systems can't do this work on their own. Community does have a lot of the solutions, and community-led initiatives have been really successful so far. The other part is to make sure that we aren't creating more burden where not needed. And so part of the coordination body is to really support our nonprofit partners to be able to do the work that only they can do, and to bring folks together and really hear from community around what it is that we need to be most successful, and then to go out and do that and implement the work. So that's just a little bit about how we're structured, and it's kind of unique, right? A lot of times we don't always see those cross sectors partnerships between community and government, and for a multitude of reasons, whether that be trust, whether that be just the history. But this has been really successful, and we're really excited for folks to be able to see this and learn from it as they can. So a little bit about what BJC is and isn't. We really consider BJC, the Birth Justice Collaborative, to be a catalyzer and a coordinator for community-driven collaborative birth justice strategies. And that looks like being an incubator for new models or policies until they actually find permanent homes. That could be with our partners, that might be with other community partners, because we love to collaborate. And part of the community-led collaborative is that we have a defined governance structure, a coordination support, and a fiscal sponsor. And so what we don't do is we don't actually do direct service. We're not a direct service provider. And we're also not an organization that operationalizes and runs long-term programs. As I mentioned, a lot of our initiatives we talk about as a pilot, as we are then incubating those things that we're demonstrating to show how they can help support our community in reducing disparities, mortality, and morbidity. But then they live and have a longer term permanent home elsewhere. We are also not a separate nonprofit organization or a legal entity, again, because we are fiscally sponsored. And so we consider ourselves a collaborative or a coalition. And part of the principle of how we really operate is that we are part of a larger whole of an ecosystem, and our priority is to align our expertise and lived experience to amplify, partner with, and enhance what already exists. And only where necessary are we actually supporting new work, and that's where there are gaps. So I can now pause for a moment for questions. That was a lot of information for new faces, and maybe another deeper dive and overview for folks that have been familiar with some of our work. And I'll also just mention that some of this beautiful art by Andreas Guzman is from our first year of convenings that we had with community. So I will stop sharing and see what questions folks might have.
Hello, Carrie. Hello, Mai. Hello, Kim. If you guys can chime in at any time and ask Karina some questions. Vanyi and I are very familiar with the work. We've been invited to some of the spaces and shared meetings and has been utilized as subject matter experts, sharing our community health worker, well, me sharing my community health worker experience and Vanyi sharing her dual services as a doula in CHW. But there's no right or wrong questions here. Just be inquisitive in this space.
I don't have any questions, Karina, but I do just want to take the time out to congratulate BJC and all of the partners on all of the wonderful work they are doing. As a doula, I do know the importance, I see it firsthand, of the work that we all do as birth workers and community health workers. Like Angela mentioned, I have had some conversations within your meeting spaces about being a community health worker and a doula, and just really wanted to give accolades to BJC and all of the partners for the wonderful work that you're doing. And thank you for kind of the outline and timeline of the success that you shared with us today.
Absolutely. Thank you so much.
Mm-hmm.
I don't want to jump the gun or anything, and I don't want to spoil your presentation, but you could talk about the doula's proclamation? Was that going to be a part of your presentation? Okay, that's why I've been hesitant to say anything, because I don't want to jump into your presentation. Hello, everyone. I think that's Carrie. She's in the chat. Let's see what that says. Hello, everyone. I'm so excited for the field expanding. Yes, definitely. So welcome to the space, Carrie.
Yeah.
Harris is a CHW. She's also with BOA. You can type everything in or come off mic if you like. Carrie, I don't want to talk for you. But if you're not in a space where you can, I have no problem reading what
Absolutely.
you have in the chat.
Maybe I'll just share, you mentioned the proclamation that was this spring. So last year, Hennepin Healthcare did the first annual doula appreciation event. And this year, BJC, in partnership with AABC, March of Dimes, some other partners, doulas, did the second annual one. And we made it a little bit different because it ended up being a doula appreciation event, but also like a community baby shower. And really what we wanted was to continue their appreciation piece, right? Because community health workers and our doulas and all the many hats that we wear, we often don't take the time to celebrate the wins, the successes around reimbursement rates from the legislature, and just some of the hard work that we do in community. And so I wanted to take a moment to give folks their flowers, while also creating an opportunity where if all these doulas and amazing birth workers are gathering, we should invite families to also come and connect. And so it was beautiful to see expecting families there. We had food shelf partners there where folks could literally grab food if they needed it. We had other resources. We had clothes, maternity clothes. A lot of our partners really showed up. Showed out.
I'm in it right now with Angela Fields.
Sorry, I'm just gonna pause that for a second, because I don't think they were talking to us. But yeah, so we did have the proclamation for May being a doula appreciation week, which, as you all know, really follows a few months of having some big maternal health awareness, which is really wonderful. So thanks for asking about that, and I hope partners and other folks in community decide to do the third annual one, because I think it's been really, really good, and it's a great opportunity for folks to connect as well. And even new doulas and new community health workers can like be invited and, you know, connect with the folks in the room.
Absolutely. Thank you for pivoting and explaining that part, Karina.
Yes.
Anyone else have any questions or comments or feedback?
I might just say, you know, part of how we're really excited and what we're looking at as we're connecting to community health workers and both learning more about how BJC can support where there's already overlap to have collaboration is really big. And as Angela and Vani have already said, they've been at our table, and so we want to make sure that we're showing up for y'all, whether that be, you know, advocacy and writing a letter of support as you all are moving policy, or just making sure that folks know, like, there's a lot of overlap and similarities to community health workers being able to bill and get reimbursed for services, and what are those services that we're able to bill for, right? I know that's a really big thing in community right now. And so that's always, you know, top of mind for us as we're thinking about, you know, how do we support, again, that larger ecosystem and landscape within our work. So yeah, and again, like Carrie said, it's really good to be expanding the field, because a lot of people have been doing this work for a long time, and it feels like we're really making some good progress only just recently. And of course, there's been good moments, good momentum, but now there's real dollars behind some of the work and real support in a meaningful way. And I think that that's made a lot of difference.
It's amazing being in those spaces and seeing you guys' progress. It's really encouraging and insightful for myself. And when I was initially invited to that space, I didn't know where my interest would go, but I just kind of gravitated to the advocacy, you know, for policy and reform and payment. And then on to like learning about cultural providers through your education, work groups and through your forums. Those were really nice and informative. So it gave me an insight on where community health workers could fit in that model of care.
Absolutely.
All right.
The other people that have hopped on.
Yeah, thank you for I apologize.
No worries.
Grandkids are excited about their first day of school. So we have these duos and they call on them. So I know that's my oldest. All righty. I'll turn it back over to you, Karina.
Yeah. Well, I think what I might do is I'll just throw my email in the chat just so folks make sure that they have it. If you aren't following us on socials, please do. We're always also looking to amplify other work that's happening. So feel free to even share events, community baby showers, things that y'all might have going on, or trainings, so that we can share it with our network as well. Just to make sure that we're reaching all the people whenever we can. But yeah, that was essentially the overview of what we've been up to. We do have our annual convening on October 1st. And that's again where we kind of invite folks into the work who haven't been a part of it, to both get, again, an overview, get grounded into it, and then also to understand kind of where we're going. It's kind of an interesting space in this moment, because we have evaluation reports that'll be coming out kind of later this fall. And so we're really excited to be able to share some of those insights too as they come, and kind of focus groups literally launching this week. And so we'll be sharing what we're learning and being able to use some of that data and that evidence and that storytelling to share like why it's so important to support the work that we're all doing, and to support community health workers, support home visitors, support advocacy and anti-bias work, and really, again, to orient that community has solutions, and healthcare systems should be partnering with community to help implement the birth justice models that we're looking to have to actually have better outcomes and to disrupt the disparities. So yeah, I'm super happy that I got to share, and feel free to reach out if there's ever opportunities for us to connect.
Awesome. Thank you for that informative presentation and that overview. I'll open it up again for any questions that we may have in this space. Feel free to enter them in the chat or come off mic and ask your questions away. Karina has added her email, her contact information in the chat. So therefore you can follow up with her as needed, or sign up for any events that they may have. I'm very, very excited. You will see me out and about at some of those sessions. I'm still learning and learning how I fit in that space, and how I myself can bring my community health worker skills and expertise in that space, in a collaborative space. So it's been very welcoming, and they do serve delicious food. A little bit that's a plug or perk. I must ask. Welcome newcomers. I saw a few new people come in. Please enter your name and your role as a CHW and your location or your organization that you're with. We'd like to know who's here with us.
And I just dropped in the registration for the fall convening. If folks can make it, feel free to. It's really cool to see all the folks in the room together. And even no matter what hat you have on, whether it's systems or providers or all the things, we're always community members too. And that's also part of what we're bringing to the space. So feel free to join us if you can, or share it with your colleagues if you can't make it.
Absolutely. Well, before we close, we don't have any outstanding announcements because this is a holiday week, and we understand everyone, may have family ties still going on or getting acclimated to the new fall schedules, such as school. I've grown beyond that part, but I understand how busy households can be at this time of the year. Without further ado, we can say goodbye to all and close out and give you a few minutes of your day back. We will be back again on October 2nd at the same time. And that topic is to be determined. We're waiting for confirmation from one of our presenters who has not confirmed yet, but I will get that communication out to everyone as soon as I know more. So I'm going to stop recording.